According to Dr. Oz, 40% of Americans are walking around with livers that are full of fat, a condition called fatty liver disease. But what's even scarier is that many people don't realize they have it. So in this video, we're going to uncover 8 signs of fatty liver disease that you might not be aware of yet. Poor dieting is always a common cause of body disease, almost always. Number 1, right shoulder pain. You weren't expecting this. I know I wasn't either. When you begin to feel severe pain in your right shoulder, it's a sign that excess fat has accumulated in your liver and it needs immediate medical attention. Also, any form of dysfunction or pain in your neck, jaw, or below the liver blade is a common sign of fatty liver disease. How are they connected? Well, your liver produces bile, a liquid element that digests and breaks down fat in the foods you eat, such as meat or olive oil. Once your liver is filled with excess fat, the bile thickens and is unable to carry out its functions, causing the liver to swell and become inflamed. The inflammation will put pressure on the phrenic nerve running along your right side, which can lead to severe pain in the upper right back muscles or your neck. While right shoulder pain can occur in individuals with liver disease, you shouldn't rule out other potential causes, including musculoskeletal issues, shoulder injuries, and referred pain from other organs. It's best to see a healthcare professional to check your shoulder pain and figure out what's causing it. They can do tests to find out what's going on and help you feel better. This next sign is more common than the rest. Number 2, abdominal fat. This is one of the most common signs of fatty liver disease. A potbelly-like abdomen simply means that excess fat is accumulated around your midsection, and this condition is most likely connected to fatty liver disease. The problem doesn't begin from your abdomen, but from the liver. The fat first accumulates in your liver, and then when it's completely maxed out your liver, the fat has to go somewhere else. If you are the type that works out, you can burn the fat before it finds a new place to stay. Otherwise, the fat will extend outwards, forming visceral and subcutaneous fat around your abdominal area. Visceral fat is dangerous because it's stored deep inside the abdomen, surrounding vital organs like the liver, pancreas, and intestines. This type of fat is metabolically active and can release harmful substances into the bloodstream, leading to various health problems such as insulin resistance, type 2 diabetes, heart disease, and certain cancers. Additionally, visceral fat can increase inflammation in the body, disrupt hormone balance, and contribute to metabolic syndrome. Note that potbelly shape is not the only sign of fatty liver. Visceral fats can be present within your organs without you knowing. The next sign is also common, but few people attribute it to fatty liver disease. Number 3, spider veins. Ever looked at the back of someone's palms and their veins had a weird spider-like form? It's called spider veins. The appearance of spider veins is a warning sign that one's liver has too much fat in it. Your liver needs a certain degree of blood flowing through it to other parts of your body. When this blood flow is compromised, it can result in increased pressure in the veins, resulting in the development of small dilated blood vessels near the surface of the skin. Fatty liver disease also causes hormonal imbalances. It alters estrogen metabolism, and increased estrogen levels can weaken the walls of blood vessels, making them more prone to dilation, and the spider veins start to appear. These spider veins usually have a central red dot with reddish extensions radiating from it. When it comes to spider veins, genetics play a role as well. If you have family members with spider veins, you're more likely to develop them yourself. Some people may inherit weaker vein walls or valves, making it easier for blood to pool and for spider veins to form. Number 4, next on the list is dark urine. Actually, your pee coming out very dark is scary, but in most cases, you'll think it's because you didn't drink enough water during the day. Many people attribute dark, thick-colored urine to dehydration, but it's not. In one of our previous videos, we mentioned how the color of the urine can project the state of our health. The same thing applies to fatty liver disease. When your liver is stressed, it begins to underperform and will be unable to effectively process bilirubin, a yellow-brown compound that is created when old red blood cells are broken down. In a normal instance, the liver releases bilirubin into the bile, which then gets excreted via the intestines. However, when the liver is damaged, excess bilirubin can show up in the urine, giving it a darker hue. Other common culprits of dark urine are exercise and urinary tract infections. Intense physical activity can lead to muscle breakdown, releasing a pigment called myoglobin into the bloodstream, which can then be excreted in urine, causing it to appear darker. Urinary tract infections can cause urine to become darker and may be accompanied by other symptoms like pain or burning during urination. These factors may be the food you eat, medication, and even dehydration. Consistent black urine, especially if combined with other signs we mentioned earlier, should be a wake-up call to get your liver checked as soon as possible. Number 5. Consistent fatigue or lethargy. You sometimes feel fatigued after a whole day's work or exercise, but there's a kind of fatigue that has nothing to do with physical activities, rather fatty liver. If you often feel tired even when you haven't done much, it's fatty liver disease. It means your body is not getting enough of the vitamins that make you strong. When excess fat accumulates in your liver, the bile will not function as it should. As a result, your body will struggle to process essential soluble nutrients from the foods you eat. Your body struggles to absorb vitamins A, E, D, and K, and also carotenoids from plant sources. The result of all of these is low antioxidants in your system, leaving you feeling regularly tired, weak, sluggish, and unmotivated. If you find yourself experiencing some of these symptoms, the best thing is to see a doctor for a diagnosis. Have you learned anything so far? Good. Now to the next sign. Number 6, easy bruising. The liver is one of those organs that takes care of blood clotting by producing the essential proteins required for that process. When the liver is compromised due to excess fat, the production of all these clotting proteins can decline. The result is that your blood won't clot as it should, causing easy bruising even from light bumps or scrapes. Of course, as people age, their skin becomes thinner and loses some of its protective fatty layer, making blood vessels more susceptible to damage. So, thin or fragile skin is more prone to bruising from minor trauma or pressure. Also, certain medications, such as anticoagulants like warfarin or aspirin, can interfere with your body's ability to form blood clots properly. While these medications are often prescribed to prevent blood clots and reduce the risk of stroke or heart attack, they can also increase the risk of bruising. If you notice that your skin has bruises, even with minimal injury, you should see a doctor. That could be fatty liver disease. Number 7, itchy skin. Regular itchy skin can be very annoying. However, many people enjoy it when they itch their skin. I don't want to call it weird, but it is. Itchy skin can be caused by allergic reactions. However, chronic and unexplained itchiness is an indication that your liver is struggling. Your liver plays a vital role in processing bile, which is a digestive fluid. When the liver is overwhelmed with fat, it will lead to the accumulation of bile in the bloodstream, which will be transported to the skin. The buildup of bile in your skin can lead to constant and annoying itchiness, especially on your feet and hands. You can use moisturizer to reduce this itchiness, but the underlying cause, if related to liver issues, needs serious medical attention. But don't get this mixed up with xerosis, which is another common cause of itching, particularly during the winter months or in low humidity environments. Dry skin can occur due to factors such as aging, frequent bathing with hot water, harsh soaps, or certain medical conditions like eczema or psoriasis. Number 8, and lastly, bloating. The liver is an incredibly strong organ that is capable of regenerating and repairing itself. However, once the liver starts to accumulate fats regularly, it gets larger, a condition called hepatomegaly. As the liver gets bigger, it presses against other organs and tissues, reducing their functionality. This also causes a sensation of fullness, discomfort, or bloating in the upper right side of your abdomen. Most of the time, you mistake this feeling for overeating or gas, especially after eating. However, with a large liver, this sensation becomes regular. So if you're the type that pays attention to your body, you'll soon realize it has nothing to do with what you eat. In advanced stages of fatty liver disease, such as non-alcoholic steatohepatitis, the liver will be inflamed. Inflammation may impair the liver's ability to process nutrients and detoxify the blood, leading to fluid retention and abdominal bloating. Bloating can also be a result of other functional gastrointestinal disorders and can also make you feel like there's too much gas in your belly. This is why you need to visit a doctor for regular checkups. Before wrapping up, let's take a moment to talk about the dietary considerations for managing fatty liver disease. There's so much you can achieve by eating a balanced diet or by incorporating a variety of foods from each food group. This includes plenty of fresh fruits, vegetables, lean proteins, whole grains, and low-fat dairy options. Additionally, limit your intake of high-calorie foods and prioritize foods high in fiber, as they can help support liver health and function. Your time and health are two important things that most likely can't be reclaimed when gone. But our body is complex, and sometimes it is easy to miss one or two signs that something is wrong. The body talks in whispers and signs, and it's up to you to listen and take action. Don't forget to like, subscribe, and share this video to spread awareness about liver health. Remember, taking care of your liver is taking care of your overall well-being. Here's to a healthier, more informed you.